So, medication management for patients and caregivers, Module 5, presented by Dr. Olufemi Williams and brought to you by my web pharmacist. So, we have a lot to cover today. Um, Here you can read who the course is for, the course objectives: empower patients and caregivers to safely manage medications, improve understanding of medication use and adherence, build skills to prevent medication errors and manage side effects, promote active participation in healthcare decisions. So that's the course objective. And today we're going to be working on preventing medication errors. Now, these are what we covered in module 1, 2, 3, and 4. So you can go back and check those modules. And what are the learning outcomes for module 5? Recognizing common medication errors and how to prevent them, develop strategies to minimize risk and ensure medication safety. And there will be 4 topics: common medication errors at home, how to double check medications, preventing drug interactions, and knowing when to call your healthcare provider for help. So, common medication errors at home. Mistakes in dosing. Sometimes some patients take too much, some take too little. This is very common when patients are taking liquid medications. So the doctor says 1 teaspoon. People have different sizes of spoons at home. 1 teaspoon is actually 5 ml. So when the doctor says 5 ml or says 1 teaspoon, the pharmacist, if it's a child or even adults, the pharmacist may give you something to measure so that you can measure the exact 5 ml. Sometimes they give you a spoon that is exactly 5 ml or something that looks like a syringe without a needle that is exactly 5 ml. So when the amount you take is important because that will determine how much medication you get. So people make mistakes of dosing. So 1 teaspoon doesn't mean you just take 1 teaspoon from your kitchen table. Another thing some people do is, depending on how much pain they are in, some people just throw in pills into their mouth and just chew and eat. No, you have to follow the directions. You can't take medications based on how you are feeling because these medications can be very, very potent. Then taking the wrong medication by accident. Now, sometimes some people, maybe there's more than one family member that is on medications, they just reach for the pill bottle and might take the wrong medication. So always make sure that the name on the bottle is yours, not someone else. Do not take the wrong medication because those are common things that happen at home. Sometimes some people have confusion over similar looking pills or labels. Always stop and take time to look at your prescription labels. Don't hurry when it's time to take medications, even though they look so tiny, some tiny little pills, they are very potent. Always read the label very carefully and make sure that the medication is yours. Even when you pick up a medication from the pharmacy, make sure you open the bottle and make sure it's the name of of the patient is your name and not someone else. How to double check medications. Always read the label before taking medication. Use a medication checklist or tracker to avoid mistakes. Ask your pharmacist about unfamiliar medications. Now, point number 2, I'm going to show you a medication checklist that I recommend everybody to use. It's free. Now, and for those of you who join, I'm going to send you a link so that you can create your own medication list so that it will be personalized to you or to whoever you're taking care of. So let's go there. Now, this is a profile that I created just so that you can see how it works. So I just called the person Mr. Wellness. He has 7 medications he's taking. So this is his vitamin, this glyburide for his diabetes, hydrochlorothiazide for his high blood pressure, Lipitor for his cholesterol, and he has another um, medication here for his high blood pressure, and metformin is for his type 2 diabetes, and niaspan is for his high cholesterol, or for some people, high triglycerides. So I just put this. This is not a real patient, but I just want you to see what you can do with this. Then health conditions. So I put that he has type 2 diabetes, he has high blood pressure, he has high cholesterol, and he's also taking vitamins and minerals for deficiency. And then I put allergies. He has allergies to penicillins and sulfonamides. So, where if you create a profile like this and you submit it, it will give you reports. So here are the reports. Now, in this case, I purposely put some things that might interact so that you see how it works. So here you see there's a major drug interaction here. And when you click on this, it will tell you more about what's going on. There's a moderate drug interaction here, a moderate drug interaction. All these ones are moderate, moderate, moderate. But I purposely put in so many things to interact. However, let me say something. Sometimes doctors will still prescribe some medications that interact, depending on what your condition is. However, it's good for you to know, just in case the doctor doesn't know. Or not that they don't know, but maybe it's an oversight. Because sometimes, not all the time, the doctor will say the benefits outweigh the risks. This is for a doctor that has been taking care of you for some time and has realized that, oh, I have to use these 2 medications, even though they are interacting. But that is after much consideration. So if you put all your medications and you see that anything is interacting, mention it to your pharmacist, but most especially to your doctor, who is going to be able to change the whole dosing regimen. Now, with this platform, you can have an app on your phone. So when you go to the doctor's office, you can show the doctor and say, oh, these are the medications I'm taking. So the doctor is going to be able to see it at a glance. Your medications, your health conditions, your allergies. And then if the doctor decides to put in any new medication, all you have to do is just add the new medication. And once you add the new medication, the whole report will change and tell you if there's something new. So you can add a new drug here. And it's just so wonderful. Now, not many people are using this many drugs, but I just put it like this so that you can see what it's going to look like. So that is that. So let's go back to our presentation. So I knew that I had to share that with you, and I will share it again in module 6. So preventing drug interactions. So drug interactions, always check with your pharmacist before adding new medications. Now, usually you don't just add new medications, but you might want to buy something over the counter. So you can check with your pharmacist and say, oh, these are my medications I'm taking. I'm going to be adding a new medication. Is it okay? Now, that tool that I just showed you makes life very simple. So you can just go, put in that new thing you want to buy over the counter, and because of a lot of strides in pharmacy now, even if you buy herbal remedies, Some of them can be checked, not all, but some of them can be checked with this interaction, med profile interaction checker. So, but then if you need help, you can call your pharmacist, or our pharmacist at my web pharmacist community can help you with that. Sometimes the drug could interact with food, like grape juice interacts with quite a number of medications. Sorry, grapefruit juice, not grape juice. Grapefruit juice interacts with a number of medications. And then it is important to keep a current medication list to share with healthcare providers. And this that I showed you can be an app on your phone which you can always at any time share with your healthcare providers. So when do you call your healthcare provider? If you're experiencing any unexpected side effects, something that the doctor did not say, or the literature you got from your pharmacist doesn't say you're going to have this side effect, then you can call the pharmacist. And if the pharmacist thinks it's important, they will also tell you to call the doctor immediately. If the medication isn't working as expected, for example, you have an infection and the doctor gave you an antibiotic and the infection is getting worse, definitely you have to call the doctor immediately. And then if you have any concerns about drug interactions, you should call the pharmacist or the prescriber as soon as possible. So that concludes the Preventing Medication Errors module 5. And we look forward to seeing you in the community, school.com/mywebpharmacist. And there you can have an in-depth training, or you can contact um, a pharmacist with questions. So for those attending a live workshop, this is the Q&A time. And then just a reminder that this is being brought to you by my web pharmacist community. So in module 6, we're going to be talking about managing side effects and drug interactions. And these are the learning outcomes. Identify common side effects and how to manage them. Understand how to prevent harmful drug interactions. And then common side effects of medications and what to do about them. These are the topics. There are going to be 3 topics. How to recognize serious side effects that need medical attention. And we're going to be talking about side effects versus allergies. Because sometimes some people think their side effects are allergies. And so we want you to know the difference. And then drug interactions, what you should know before taking new medications. Talking to your pharmacist about potential risk. Okay, so that is the end of Module 5, Preventing Medication Errors. And we hope to see you in the school community, my web pharmacist.